Knock, knock. Okay, my name is Amy. I'll be the nurse practitioner student. I'll be helping you today. I'm washing my hands. I don't have my badge. This is the patient I'll be assessing today. Hi, what's your name?
Marissa Lopez.
Hi, Marissa Lopez. When is your date of birth?
10/18/1990.
Okay, and your age?
34.
34. Okay, and then your preferred sex?
Female.
Female. And then for your chief complaint today, what is bringing you in today?
Just an annual exam physical.
Okay, physical exam. Any past medical history that I need to know about?
It's my own medical history.
Yes,
just migraines.
Migraines.
Diagnosed migraines with the aura.
Okay. And then any other history?
Obesity.
Obesity. Any hospitalization for the migraines or the obesity?
Just initially found out that when I was having those migraines too.
Okay, so you've been diagnosed.
Yeah, when I got diagnosed.
Got it.
Yeah.
Okay. Any recent surgeries?
No surgeries.
No surgeries. As far as your migraines, are you currently taking medications for it? How is that helping you? How are you dealing with the migraines?
Just over the counter.
I'm so sorry.
Oh, it's okay.
Over the counter.
Tylenol and Excedrin.
Okay, Tylenol. And how often are you taking Tylenol, and what's the dose?
I would say, because I tried to stay away from it, but I would maybe use it 3 times a day. Dose anywhere between 500 to 1,000 milligrams.
500 to 1,000 milligrams. Okay. Any recent surgeries?
No surgeries.
No surgeries. And are you currently seeing an OB, GYN?
OB, I am right now about 3.5 weeks postpartum.
Okay. Congratulations on the baby.
Thank you.
And then when is your next appointment for your OB?
December 11th.
December 11th. Okay. Any complications with your birth or the delivery? Sorry.
Not any serious complications. Just a little scared when baby came out. Super congested. Sat in for like 10 minutes in the 80s until they were able to open her mouth to suction. But after that, she was fine.
Okay. And she followed up with her pediatrician. Everything's okay?
Yeah, everything.
Okay.
Overall healthy baby girl.
That's good. Okay. And then for immunizations, are you up to date for your vaccinations?
Yes, but I declined the flu shot and the RSV shots.
Okay, so flu and RSV. Okay, and have you been sick recently?
No.
Okay, that's good. Are you taking medications or over-the-counter medications right now?
Just the postnatals.
Okay.
And then I take an extra iron supplement, 25 milligrams, once a day.
Once a day. Okay. Any allergies to medications or food that we're aware of?
No allergies.
Okay. I'm going to ask you a few questions about your family history.
Okay.
For your mother, any medical history?
History, hypertension.
Okay.
So she has high blood pressure, and then anemia on her end. She's had where her hemoglobin dropped below 7 before.
Okay. And is she currently taking medications to treat that?
No, just vitamins and then electrolytes, and then she takes her blood pressure medication.
So electrolytes. And then for your father, any health issues that we're aware of?
For him, he was overall healthy, but he had cancer, and he ended up passing from that cancer.
Okay, I'm sorry to hear that. How did you cope with his death?
He had a long battle with cancer, so when he passed, it was kind of a relief for me and my sister and for him, because he was struggling a lot with the chemotherapy and making him sick and things like that. So
okay,
more like a weight lifted.
Okay, and you're dealing with it okay right now?
Yes,
okay.
It's okay.
And then for your mom's mom, any medical history?
Yeah, for her, diabetes and hypertension.
Hypertension. And then what about your mom's dad?
For him, it was just the diabetes.
Mm-hmm.
And I think he was on taking Eliquis at some point. And he has like some blood clots.
Okay. Like DVTs?
Yeah, just
Okay.
it's just small ones. So he was
Baby
taking or Plavix or something like that.
Okay. And then for your dad's mom, any medical history?
Dad's mom, I know she had hypertension, but I don't know too much on my dad's.
Your dad's side?
Yeah, dad's
Okay.
side.
Okay, so then I'll continue with the questions with chemical history. Any history of tobacco use, cigarettes, vaping?
Yeah, for me, younger years, probably like 19 to 27, I smoked cigarettes.
Okay.
Probably about two packs every 2 days.
2 packs
Or
a pack a day?
A pack every 2 days.
A pack every 2 days.
Yeah.
And are you currently smoking now?
No.
Okay. And then for alcohol use, any alcohol history?
Yeah, when I was younger, definitely, going out a lot, so I drank more. But now, not at all, rarely.
Okay. And when was the last time you drank?
I did have a beer on the holiday on Thanksgiving.
Okay, so that was like 2 days ago?
Yeah.
2 days ago. And then for caffeine, any history of caffeine?
Oh yeah, caffeine definitely, but since pre-baby and then post-baby, I've limited my caffeine to 2 shots a day.
2 shots. Okay.
That's my max.
Your max. Okay. And then illicit drugs. Are you currently taking any drugs?
No drugs.
Okay. Okay, so we're gonna move on to the next one. For social history, are you married, single?
Recently married.
Okay. When did you get married?
June 1st.
June of this year or?
Yes, this year,
Okay.
24.
2024. Okay. And then for sexual history, we're gonna ask you, how are you using protections? What's your
Mine was a condom.
condoms?
Protection.
And then have you gotten tested for STI?
I think before my delivery date, they took labs and they tested me for like some STIs.
Okay.
Yeah.
And how were the results?
Negative.
Negative. And then for occupation, what are you?
LVN.
Okay, LVN. And what does LVN stands for?
A licensed vocational nurse.
Okay. And are you currently employed?
Yes.
Okay, employed. And then for housing, are you living with your husband in a house?
Yeah, I live with my husband in a small apartment.
A small apartment with husband. Okay. And then for diet, are you on a strict diet?
Right now, no, because
Okay.
I am postpartum. I'm kind of just eating what I can when I can.
Okay.
Because baby is to get the breast milk.
breastfeeding?
Yeah, breastfeeding. It's like it seems like I'm hungry all the time.
Okay. And you said no known allergies to food that you're aware of.
Yeah, no
Okay.
known allergies.
Okay, and then what about sleep and stress? I know you just had the baby. How is that going?
Definitely sleep deprived.
Okay.
Maybe averaging like 4 hours a day of sleep.
4 hours.
So definitely that causes me stress and definitely doesn't help my migraines.
Okay, so has your migraines gotten worse since the baby?
Yes, actually, they have.
Increased migraines. Have you talked to your OBGYN about the migraines? Because it could potentially, indicate postpartum or like preeclampsia or eclampsia.
I actually haven't had a chance yet, so I've just been trying to stay hydrated and taking Tylenol.
And it's still working for you?
Sometimes,
Okay.
yeah. Sometimes I just feel because I lack of sleep, it doesn't really.
Okay.
Do
And
anything.
then so you said you've been feeling more stressed because of the sleep deprivation.
Yeah, and I think the headaches have a lot to do with that, the stress, because.
The headaches. Okay.
Yeah.
And then for your eyes, any injuries to your eyes? Have you had blurred vision?
No, eyes are okay.
Okay. Nice. And then notice any drainage to your ears? Any congestions with your nose? Sore throat?
No drainage.
Okay.
Yeah.
And then any chest pain that you've noticed?
No chest pain.
No chest pain. And then any issues with your breathing, respiratory issues?
No, breathing's good too.
Okay. Any abdominal pain recently that you're aware of? Any?
No abdominal pain, just the cramping while breastfeeding.
Okay, which is normal.
Yeah.
Okay. So cramping with breastfeeding. Okay. But no diarrhea, nothing like that, constipation?
No.
Okay. And then any GU issue? Are you feeling any burning when you urinate? Any abnormal discharges?
No burning. I'm still bleeding though.
Okay. Postpartum bleeding?
Yeah.
Okay.
Yeah.
Which did your
with some discharge, but I don't know if that's normal or not.
Does it burn?
No.
Any fever?
No fever.
Okay. Nice. And then any muscle pain? Have you noticed, your arms not being able to function as well?
Just still having like the feet, feet swelling.
Okay.
Still having the feet swelling even before during the pregnancy and then after. And then just sometimes I get like numbness in my feet and hands, but it's not consistent.
Okay, and have you followed up with that with your OB after delivery?
Not yet.
Not yet.
No.
Okay. Okay, and is the feet swelling consistent all day, or does it?
Well, for sure the first 2 weeks it was like every day. This week has been better.
Okay, do you notice it in the morning, midday, during the night?
Honestly, it's throughout the day, all day.
Throughout the day.
Yeah.
Okay, all day. Okay, and as far as your breast, have you noticed any issues with that, with the baby feeding? Any discharges to your breast besides the milk?
Yeah, no discharge.
Okay.
Just not when I don't pump properly. I notice like
engorgement.
Lumps,
engorgement.
Yeah,
okay.
Yeah.
Any skin issues? Any rashes that you've noticed?
I think the only rash I got was from the postpartum briefs.
Oh, the briefs. Okay.
On my bottom.
And are you treating that with cream? Or just consistent
I guess
drying?
just keeping it clean and moisturized, and now I'm not using the briefs, just the overnight pads.
Okay, and that's helping?
Yeah.
Okay. And then for your, with the whole postpartum, what do you call that? Swelling, have you noticed any unintentional weight loss?
No weight loss.
Okay. And then any injury to your head that we're aware of that can potentially cause the migraines to?
No injury.
Okay. Nice. And then lastly, just to recap, you said no allergies to medications, no allergies to food that you're aware of? Okay.
Right.
And then that ends our assessment for today, which is November 30th.
Okay.
So we are done with our well exam.
Okay. Sounds good.
Thank you.
Thank you.